Hi everyone, my name is Olivia Dillman and I'm a third-year medical student at Ohio University Heritage College of Osteopathic Medicine, also known as OUHCOM. I was able to work on this study with Dr. Allison Hughes, our principal investigator, and Jenna Barrett, a fourth-year medical student at OUHCOM. Our pilot study was focused on building disability competency in osteopathic medical students in rural Ohio. I'd like to begin with a little bit of context on our research. The largest proportion of Ohioans with disabilities live in Ohio's rural Appalachian counties. The Appalachian region falls below the national average in both mental and physical health outcomes. Figure 1 on the left includes data sourced from the CDC's website on disability and health promotions. As you can see, adults with disabilities in Ohio experience health disparities and are more likely to report higher percentages of depression, obesity, smoking, heart disease, and long COVID. Some contributing factors to these trends include systemic issues such as socioeconomic disparities and barriers to healthcare access, including shortages of healthcare providers due to the relative remoteness of many Appalachian communities. Compared to Ohio adults with disabilities, those in the Appalachian region are more likely to live below the poverty line, have lower educational attainment, and be unemployed. Addressing these issues is crucial for improving health outcomes in this region. Currently, individuals with intellectual and developmental disability, also known as IDD, must travel over an hour to Columbus or Cincinnati for specialty care from disability competent clinicians. The objective of the study was to determine whether focused IDD education and training can improve future physicians' understanding of IDD, increase empathy, and reduce bias towards the patient population, with the ultimate goal of improving healthcare that the adult population with IDD will receive in their local community. Methods of the study utilized surveys as the primary methodology. Participants completed 3 pretest surveys that evaluated general knowledge, empathy, and bias towards IDD. The Jefferson Scale of Empathy was used to assess empathy, and the Attitudes Toward Disabled Persons Scale was used to assess bias. The JSC comprised of 20 items, with half being positively worded and half being negatively worded in regard to those with IDD. The ATDP contained 2 sets of items, with the first set describing those with IDD and the second set describing how they are treated. Both surveys utilized the Likert scale. Following the pretest surveys, participants completed a 3-hour in-person training session on IDD. After the training, the same 3 surveys were administered to participants. Participants in this study included first and second year medical students at OUHCOM located in Athens, Ohio. Components of the training included a brief informational session on IDD led by our very own Dr. Allison Hughes, a Q&A panel that included both people with IDD and their caregivers, and 2 research presentations from established social scientists who have conducted research in the field of IDD health disparities. Demographics can be viewed in Figure 2, located in the center of this presentation. The majority of participants identified as female, half participants identified as Black or African American, and the other half participants identified as white. The average age of participants was 26 years old, and the majority of participants were first-year osteopathic medical students, with that percentages being 66.6%. 2 students also reported having a family member with IDD. Results included paired sample t-tests and are able to be viewed in Figure 3 on the right, with light blue columns showing a mean pretest score and dark blue columns showing a mean post-test score. The response rate for the study was 66%. The final number of participants was 6 medical students located at OUHCOM. There was a significant difference in the general knowledge scores for pre and post test with a p-value of 0.001. There was also a significant difference in the empathy scores for pre and post test with a p-value of 0.041. Differences between pre and post test for bias scores were not statistically significant. In conclusion, this study investigated whether focused education and training on IDD would improve future healthcare professionals' understanding of IDD, increase empathy, and reduce bias towards this patient population. The intervention demonstrated statistically significant improvements in both general knowledge about IDD and empathy towards patients with IDD among the medical students following the intervention. Importantly, the intervention did not show a significant change in attitudes toward disabled persons. Limitations of the study included the small sample size and selection of participants from a single rural medical school. Although our results should be generalized with caution, this pilot study provides encouraging preliminary evidence that focused education and training on IDD may be beneficial for future healthcare physicians and their patients, as it has the potential to improve knowledge and empathy in this population. Importantly, osteopathic medicine is focused on a holistic view of medicine that considers the entire person when managing medical conditions and considering avenues of treatment. Every physician will encounter IDD in their respective practice. In order to maintain a person-centered view of care, it is imperative that osteopathic physicians understand the nuances of conditions that affect this population. Future research directions include expanding the scale of this training to include a greater sample size, which would be achieved perhaps on a school-wide scale, and or integration into a school's preclinical curriculum. Our team would like to recognize the WITH Foundation for providing support and for funding this pilot study. Thank you.